hello there. We're going to take a few minutes and go through the malignant hyperthermia cart. This is going to be used for patients or potentially suspected patients for malignant hyperthermia. So for surgery or endoscopy patients, these departments have the malignant hyperthermia carts in their location. Additionally, for patients in ED or ICU that may be triggered by a rapid sequence intubation with a triggering agent there, they would need to call either one of the departments of surgery or endoscopy for the malignant hyperthermia cart to be brought to their unit. So what you're going to find on this cart is there's going to be a poster here that's on the top of the cart. This really walks you through the signs and symptoms for diagnosis of malignant hyperthermia, but then it really lines out in many steps what to do first, second, and so forth, so that you know you're managing your patient appropriately and doing things that are most critical for the success of the patient. Additionally, other resources. So in the top drawer, you're going to find a paper document that is a 4-page document that basically, again, it walks you through not only signs and symptoms, but also treatment and what you're doing for each stage of this patient. You will find also the malignant hyperthermia policy. Not that you'll pull this out in a crisis, but this is more meant for a downtime scenario where you can take this out, review it, see if there's anything else that you would need to learn about malignant hyperthermia. Some of the resources that you really should look at pretty quickly are a dosing chart. So rather than have to figure out exactly how much dantrolene you need to give to the patient, you can look at the patient's weight and it'll tell you how many vials of dantrolene to mix. There are also pocket cards that are also laminated. You can hand these out to others in the room that are a representation of what's on the poster as well. For operating room staff, there is also a reference here for how to prepare the OR suite when we have a suspected or a family history of malignant hyperthermia. You would want to post these signs outside of the room so that you know that these are potential patients. So that really is the top drawer for references. And as we work our way through the cart, you're going to find blood gas syringes or full kits if you need those. You're also going to find lab tubes when you need to draw a specimen to try and diagnose any other things happening with the patient. A sterile specimen container for your analysis. And then you'll find IV tubing as well. We designed this cart kind of with Murphy's Law in mind. That maybe you have exhausted all the supplies in your location. So also we have extra syringes. So we're going to be using 60 ml syringes to mix the Dantrium, which is our current product, and other syringes that you might need, other sizes. But again, this is just to supplement what you're going to find in your trays that you mix with. In drawer 4 of this cart is where the actual dantrolene is housed, and you're going to find it in trays like this. Okay, so there are bottle spikes that look like this that you're going to use on your syringes to mix the dantrolene. Additionally, in that same drawer is sterile water. So this is actually mixed with water and not with saline. The reason you do that is because saline will form a precipitate. So you always want to make sure that you're using sterile water. The way that we do that, again, we have the bottle spike, your 60 ml syringe. You're simply going to open your bottles. If it's close at hand, again, we need to get this dantrolene to the muscle as soon as possible. So we are going to place our bottle spike in the water. Add some air and withdraw the water. You're then going to take this bottle spike into your dantrolene. Add your water. So you'll find that this goes into solution. Now, I'm actually doing this with a smaller amount of water just because of my syringe size, but 60 mLs of water would make this to go into solution pretty quickly. Okay. Now, a typical dose of dantrolene is going to be approximately 12 to 13 vials. So you can see how you're going to need to assign people to be mixing, because this dose can be repeated in about 3 to 5 minutes. So that's going to be a big key. You can actually pull these trays out, take them over to a location and set up a mixing station, so to speak. And that would be probably one of the most efficient ways to get that medication to the muscle. Okay. Other supplies that you're going to find in this cart are central line kit. So we know that we're going to be needing to give lots of medications, and basically we're going to be treating this patient potentially like we're coding. Okay, you can definitely end up down that path. We have arterial line kits as well as arterial catheters. Your pressure bag for your arterial line is here. The only thing that's not in here is going to be your solution for your art line to set it up. So you would have to get that. We do have nasal airways. Yankauer and suction tubing are in here as well. And a Salem sump, as well as esophageal temp probe. We're going to want to monitor the patient's temperature, and as you'll be learning during your simulation, the temperature really is a later sign of malignant hyperthermia, but we do want to monitor that so we can keep a close eye on what that is. Another way that you can do that is by anchoring a Foley that has a temperature sensor, and so that would be another thing that you would want to do. We have supplies for lavage, so these would be items sterile that you could open to a sterile field, or you might be accomplishing that kind of in a different way. So we have sterile basins, irrigation tubing for that. We also have, as one of the things that we would need to do for the anesthesia circuit, is to change out the soda lime canister, and then this anesthesia circuit as well. So those are items that are in here. Now I will say that changing out the soda lime and the circuit, you will find on the list that that's not the first thing to do. We want to make sure that we get the medication mixed, and that it is going to that muscle. Again, that's where that medication works, and so we want to make sure that's one of the first things that we do. Some other information on the cart are numbers to call. So the Malignant Hyperthermia number is on here to the Malignant Hyperthermia Association. They will help walk you through an emergency, okay? Also, for our in-house numbers, if you need to call a code and you need help with the code team responding, we're dialing 77. Also pharmacy 5275, as well as the NAC at 8640, so that you can get enough people to help in this crisis. I think that's it. Enjoy the simulation and let us know if you have any questions.